Thank you. Good evening. This is 12-year-old Rory Staunton. He was playing basketball in school, fell down, had a cut on his arm near the elbow, went back home and complained to his mom and his parents about a little bit of leg pain, some stomach ache, just not feeling well. Next day he felt a little nauseous. So just to be sure, his parents were extra cautious and took him to the pediatrician's office. At the pediatrician's office, the clinician noted some mottling on the skin, but attributed the general clinical picture to a GI bug that was going around. Yet, to be sure, he sent him to the ED. At the ED, he received some fluids because they thought there might be some dehydration. He was given some maybe painkillers, something to bring down the fever, something to take care of the nausea, and discharged home. The blood work that was done in the ED came back after he was discharged. Unfortunately, it was abnormal. The blood work showed an evolving septic picture. It had bandemia, so very significant indicator of infection. The tragedy was nobody from the ED contacted the pediatrician or the family. And this kid went home, his condition worsened. The next day, further worsened, came back to the hospital, was admitted with multi-organ failure, had sepsis, and unfortunately died. So here you have a cut on the elbow playing basketball, and 3 days later, this child was no more. This is Jessica Santillan. She had a congenital heart disease, restrictive cardiomyopathy. They crossed into US illegally so that she could be treated. They were illegal immigrants that found a home in North Carolina where some of their family members lived. To cut a long story short, she was placed on the organ donor list because a heart and lung transplant was the only way out for her. One day, the Duke University Hospital in North Carolina gets a call from the UNOS, the organ transplant coordination site, and they say, we have organs available from the New England area. Coincidentally, the two patients that were eligible were found to be clinically not suited for that transplant. Just before the surgeon is about to keep the phone, he says, hey, you know what? Let me tell you about this 16-year-old Mexican illegal immigrant who's for the last 3 years on that list. She could really benefit from this heart and lung transplant. The organ transplant center thought the clinician had all details. The clinician thought the organ transplant center had all details. In any case, the organs were harvested. They came down to North Carolina, and they were being transplanted into this young girl. Everybody was hopeful that finally, something was happening. Only towards the end of the surgery, or just after it, they suddenly realized that the organs were from a type A, a blood type A, and she was blood type O. So literally, they put in organs that her body was going to reject, had already rejected. She went into a coma, and there was a big tragedy here. Over the next few days, they tried another round of transplants. That was again controversial, but we finally lost her. This is Cal Sheridan. Cal, when he was born, just 16 hours after his birth, they noticed jaundice. At 36 hours, he had head-to-toe jaundice, yet discharged him and reassured the parents who were repeatedly asking the clinicians if something wrong. They said, no, don't worry, this is just newborn jaundice, it's normal, it'll resolve in a couple of days, put him in sunlight. This is about 30 years ago. So they said, just put him in sunlight, expose him to sunlight, and we'll see you in a few days at the 1-week baby visit. 4 days later, the mom thinks the baby is fatigued, he's not latching on, he's not breastfeeding, calls the nurse. The nurse says, are you a first-time mom? She says, yes. That's what must be going on. Don't worry, don't get anxious, it's normal. At the 1-week visit, the baby's condition worsens, and they admit him to the hospital where a bilirubin test is finally done, and it is one of the highest ever recorded in that hospital for any neonate. So he had full-blown jaundice. At that admission visit, he had clinical signs of a condition called kernicterus. That's when the bilirubin attacks your brain and causes neurological damage. Unfortunately, even those signs were missed and a diagnosis was not obtained until the child was 18 months old, causing severe cerebral neurological deficits for this child. He, of course, is alive. He is a comedian, in fact, and is a champion for, of course, patient safety. The family saw tragedy twice. That actually is a childhood picture of Cal with his father, Patrick. Patrick, young in his 30s and early 40s, to cut a long story short, discovered that he had a cervical mass. At a very high center with wonderful academic credentials and experts from neurosurgeons, they extracted the mass. They said, "You're fine now." And the pathology initial preliminary report that has come back is fine, so this is benign, it is not malignant, so don't worry. They go back home. Only 6 months later, his pain comes back, his condition worsens, and when they approach the doctors, what they realize is the final pathology report that indicated this was a malignant tumor, actually a very aggressive sarcoma, back then was paper records, so that was just filed. We see so many cases that even the electronic record, we sometimes have such miscommunications. But the point was, the aggressive sarcoma was not known for 6 months. The cancer spread to the spine and resulted in 7 or 8 surgeries, paralysis down the neck, and the family lost him at the age of 45. So 2 misdiagnosis tragedies for the Sheridan family. That's Miss Davy Eason. Lumps in the breast, FNAC, or biopsy was done. The pathology report that came back was aggressive lobular carcinoma. She was really sad. She's a single mother taking care of a 15-year-old child. And the doctors and surgeons all suggested there's only one way out. You need to do a radical double mastectomy. Basically, loosen both your breasts to avoid the cancer from spreading. She was overwhelmed. She went for a second opinion. The second doctor relied on the same reports and suggested the same thing. Unfortunately, what happened is after the 2 breasts were removed and they were sent to pathology called the surgeon and said, "Hello, what's wrong? This is perfectly normal breast tissue. Why did you remove it?" That's when they realized that in the pathology where the samples were arriving, the samples were mislabeled. Someone who had cancer, aggressive cancer, was told, "You don't have cancer." And this single mother was told, "You have," and then she had to undergo the unnecessary procedure and the reconstruction surgery after that. That's 15-year-old Louis Blackman. About 20-ish years ago, this is a child who was born with something called pectus excavatum. It's this kind of a depression in the chest, like a small cavity here, which when the child grows up can maybe cause some issues in the rib cage, maybe lead to breathing. In any case, his parents were very careful. They did not opt for immediate surgeries because they had heard horror stories and they knew that this was an open surgery that would take 5 hours and it can be very risky. So that's why when the newspapers reported of a surgeon in South Carolina that had very good results, they were hopeful and they wanted their son to have a good future, so they took him there. The operation went fine. It took more time than required. That was the first red flag for the mother. The mother was worried. But the surgeon came and reassured her, "Don't worry, everything's fine." This is Thursday night, Friday. Friday, there's another surgeon who comes and takes a look at him, says, "You know what, he seems fine, he'll recover fine." Over the weekend, no surgeon or attending doctor, or a doctor out of their residency, a fully attending consultant doctor, was available, and only residents took care. And there was a series of events where the mother was very worried about the deteriorating condition, the high pulse rate, and the pale face and the immense pain of this child. And the nurses tended to ignore it. They said, "Don't worry about it. It happens." At one point, the abdomen was bloated, and the nurse came and said, "This must just be gas. Don't worry about it." But he was having extreme pain. To cut a long story short, this child, to relieve him from the pain, the post-op pain, was given a painkiller that had serious side effects and at a dose which was not suited for him. So it resulted in ulceration, and literally he bled to death. When an autopsy, I think, was done, they found 3 to 4 liters of blood in the abdomen. And typically, a human body has about somewhere between 5 to 6, and he was just a kid. This is Julia Berg, 16-year-old teen who just had extreme fatigue, had some flank pain, went to her pediatrician just to be sure because she was about to take a long family vacation, travel out of the country. The pediatrician takes a look and thinks first maybe this is some infections, gives her an antibiotic. The next time she comes, because of the flank pain, he says, you know what, just to be sure, go to the ED, get a CT scan done, and you'll be on your way. In the ED, the CT scan is done, inflammation in the gallbladder and liver is found. No stones are found. Yet, it starts a series of diagnostic workups and whatnot. The patient is admitted for about a week, and they finally decide, you know what, all her symptoms might be attributable to something going on with the gallbladder. They do consults with the adult surgeons, and they finally decide they'll take out the gallbladder and make sure that nothing's wrong with the liver or pancreas. They do that. A surgery is done. It takes, again, more time than required, but the parents are reassured. Immediately post-op, the mother is noticing the child's condition is worsening. The nurse tells her, don't look at the screen. That's not meant for you. That's meant for us. She says, there's something wrong, something wrong. Suddenly, the child crashes, and she's no more. She suddenly dies. An autopsy revealed Epstein-Barr virus infection. When they went back, they realized that at the very beginning, there was massive lymphocytosis. Lymphocytosis, along with the clinical picture at that time, should have triggered a differential diagnosis of infectious mononucleosis. That was the condition, and just imagine 3 weeks later where it was, and she underwent this surgery and passed away. That's Thomas Eric Duncan. He goes to an ED in Texas, tells them he has fever, nausea, abdominal pain, and he just traveled to Africa. They think of multiple things. They do a CT scan, whatnot. The complete workup is done. He's said there's no red flags. You can go back home. This is just some sinusitis. He's given Tylenol antibiotics. 4 days later, he comes back in extremis, in very worsening condition. He was actually the United States' first Ebola patient in 2014. We misdiagnosed Ebola despite that ED being trained to identify patients that had a travel history from Africa. It's a famous actor, John Ritter. His chest pain was attributed to an MI. Turned out it was an aortic dissection. Jake Tapper, famous CNN anchor, his daughter went to the ED, and they thought that her abdominal pain is attributable to some kind of GI bug or infection. They did not listen to the family, and they kept making sure that their diagnostic momentum was right. The family kept asking them to investigate for appendicitis. They didn't. She basically had a ruptured appendix and went into sepsis. But she's alive and she survived. Dr. Lisa Simpson, a health services researcher, herself the deputy director of AHRQ, she had a lump in her breast, and when the biopsy was done, the report came back. The first one was incomplete or inadequate sample. The second page had the story of one sample indicating metastasis. The doctor missed it. There was delayed diagnosis of breast cancer. She had to actually get treated when she was pregnant. And so we have a number of cases, and this one is an adult 32-year-old patient with abdominal pain, fevers, leukocytosis, all signs of infection and developing sepsis, and he died 26 hours, and the clinicians in the ED or the hospital medicine, they missed. The point of these stories is to let you know that diagnostic errors are kind of inevitable. They are bound to happen. But for each error story, there are probably hundreds of patients that were treated and diagnosed in a timely manner. But even one case is one too many. And I think if we learn from each story and develop in ourselves this appreciation of someone else's pain, the patient's pain, I think that's what defines us in the world of medicine as lifelong learners, because we need to have lifelong empathy. The reason I bring up these stories, diagnostic errors are a serious problem and there's a lot being done about them. But to quickly give you one parting note, which I think signifies the importance of learning from each case, and I'd like to actually read, this is from one of my favorite US clinicians, Dr. Gurpreet Dhaliwal, and he co-authored this paper, and they said, this is the era of AI. So definitely organizations should welcome large data sets into their portfolio of approaches to detect and measure misdiagnosis. There's no doubt that AI is going to be all around us. But they cannot lose sight of this persistent problem in quality that data cannot change practice. In fact, they say clinicians quickly learn that the most powerful stories are the ones where their own patients are the protagonists, and that patient-specific feedback is the strongest motivator for improvement. The creation and sharing of these stories should remain a priority even with the rise of big data. Technology has made amazing progress in recent decades, but the human brain has not changed one bit. The story, and I repeat, the story, not the statistic, remains the brain's preferred unit of learning and the most powerful tool of persuasion. So if there's anything that we want to take away from errors that are inevitable to happen, is the earnest this feeling of humility that we learn from each experience so that we can avoid more pain. The route to that learning is through the feeling of empathy. And we'll always have this challenge in trying to sustain it because we are already facing burnout issues. Thank you.